Hello, everyone, and welcome. So I think we're going to go ahead and get started. So thank you so much for joining us today for this special webinar titled Mind-Body Synergy, Using Mindfulness to Enhance Cardiometabolic Health and Lower Blood Pressure. So my name is Frances Sadi, and I serve as the Associate Director of Non-Degree Programs here at Brown University's School of Professional Studies. At Brown School of Professional Studies, our mission is to support adult learners at every career stage in gaining the tools and perspectives to lead meaningful change in your lives, communities, and organizations. So today we are honored to share with you a program that sits at the intersection of mindfulness and medicine. So the program Mindfulness-Based Blood Pressure Reduction, or MBBP, is an evidence-based 8-week course developed and tested here at Brown by our featured speaker today, Dr. Eric Loucks, who is a leading voice in cardiovascular research and also the director of the Mindfulness Center here at Brown University's School of Public Health. So whether you're managing your own blood pressure, supporting a loved one, or simply looking to bring more awareness into your health decisions, today's session is a chance to learn, reflect, and connect. Personally, this program is near and dear to my heart, as I was fortunate to have worked on the original National Institute of Health funded research studies on MBBP between the years of 2015 and 2020. So I have seen firsthand how powerful this integration of science and mindfulness can be, supporting not only physical health, but emotional and relational well-being as well. So over the next hour, you are going to learn more about the evidence behind MBBP and how this 8-week program builds on the foundation of the renowned Mindfulness-Based Stress Reduction, or MBSR program, applying mindfulness in targeted ways to support cardiovascular health and inspire a healthier, more balanced life. So before we get started, just 2 quick logistics. So first, we welcome your engagement throughout the talk. At the end of the presentation, we will open things up to questions. So please feel free to send us your thoughts and questions using the Q&A feature found at the bottom of your screen. And second, we are recording today's session. And we'll send out a link to the recording later this week by email. So please don't feel like you have to take careful notes or remember all the details. And of course, we invite you to share the recording with your friends, coworkers, and loved ones, anyone who may benefit from a program such as MBBP. And now I am honored to introduce and hand things over to my friend and colleague, Dr. Eric Loucks, who is a leading expert in cardiovascular health research and mindfulness here at Brown University. Eric is the founder and director of the Mindfulness Center at Brown University, which is a leading hub for mindfulness research and education. A professor, researcher, author, and pioneer in the study of mindfulness and health, Eric has developed impactful programs like Mindfulness-Based College for young adults and the MBBP program, which we're going to explore more today. Throughout his career, Eric has taught at Harvard, McGill, and Brown Universities. But beyond his impressive accomplishments, I deeply admire how Eric embodies mindfulness throughout everything he does, using it as really a guide, allowing it to guide his decisions with clarity and care. So Eric, thank you so much for being here today.
Great. Yeah, thanks. So yeah, really nice to be here with you today. It's fun to see where folks are joining from all around the United States, but even as far away as India and Guatemala, for example. Uh, with the title of the program today being, mind-body synergy, using mindfulness to enhance cardiometabolic health and lower blood pressure. We all came here for a reason. There's lots of things you could have been doing with this hour, but you chose to be here. And I would even invite you to um, consider what brought you here today. And even if you feel comfortable enough, just popping it in the chat box about what brought you to be interested to attend this masterclass today. And that will help me get a sense of what folks are here for and what drew you to be here. So if you'd like to just pop in the chat box what brought you here today, we can all see what's driving us here. So go ahead and enter that as you're ready. Yeah. Okay, so we're seeing
Mm.
some pieces come in, like say using meditation to slow down or to control blood pressure. A number of people have that. Working to develop a wellness program for military members, which I've done some work with. Preventive self-care. Some of us are here to help our family members to lower blood pressure, but also to lower anxiety.
Mm.
We'll get at some of the mental health components of MBBP as well. So, some people looking just for curiosity and a number of just different pieces. So great. So that'll help me to know who's here in the room as well. And for us all to build a bit of a sense of community as we're gathering here together today. So what I'll do is just give like a bit of a presentation on some of the impacts of mindfulness training on cardiovascular health and blood pressure reduction in particular. And then I'll lead a mindfulness practice that's consistent with what we offer in the mindfulness-based blood pressure reduction program. And then we'll get a chance just for like questions and answers as well. So it'll give you a chance to try and emphasize what some of the evidence suggests, but also what some of the practices are too. Uh, okay, so I'm just going to share my screen. Uh, and just take a second. Okay, can you see the screen okay?
Looks good.
Yeah, okay, good. Okay, so, not everyone's going to be familiar with what mindfulness is, and, here's some common definitions of it. One is from John Kabat-Zinn, the awareness that arises from paying attention on purpose in the present moment, non-judgmentally. And so mindfulness often has like a few different components to it. One is present moment awareness of our thoughts, emotions, and physical sensations, which are just about the entirety of the human experience, being in one of those categories of our thoughts and emotions and physical sensations. But it's not just present moment awareness, it's the quality of that awareness, that it's non-judgmental, for example, or that there's acceptance there, friendliness, curiosity, kindness, that it's almost like a scientist just observing the data coming in through our senses, like our eyes and ears, smell and taste and touch, and as well as coming in through our emotions and our thoughts. And then a third piece of it is the element of remembering that sati, the Pali word for mindfulness, shares a root with the Pali word for arrow, which is sara. And Buddhadasa Bhikkhu talked about how mindfulness is like an arrow, bringing our wisdom into the present moment. And thousands of years ago, an arrow was the fastest weapon available. And so, wherever we get our wisdom from, whether it's from public health messages, for example, around how to control hypertension, or maybe it's from wise people that we've learned from, or maybe the wisdom's coming from our own hard-won experience, it doesn't really matter if we have it unless we apply it right here, right now. And so another piece of mindfulness is applying our wisdom to the present moment so that we can actually act on what we know and to become who we really want to be. And so when we think about hypertension itself, it's maybe the major driver of cardiovascular disease. Smoking is way up there as well. And there's many drivers of cardiovascular disease, but uh, hypertension is very modifiable. In fact, we can control it in just about everybody with what we know influences blood pressure, but still, half of Americans have it. And of them, about half don't have it controlled. And so it's highly prevalent around the world. And it can do a great amount of good for our risk for cardiovascular disease like heart attacks and strokes to lower the blood pressure into ranges that are healthy. These are the latest guidelines from the American Heart Association that just came out just a week or two ago. I actually just updated this slide thanks to physician Vinny Vinicius, who's on this call, doing a postdoc with me. And so, basically what's recommended is having systolic blood pressure less than 120 and diastolic blood pressure less than 80. So we've allowed anyone above that to come into our mindfulness-based blood pressure reduction programs in order to even just prevent it from getting higher, or if it's really high, to help bring it down. Uh, these are some of the major evidence-based approaches to bring blood pressure down, such as weight reduction that can really make quite a difference, like 5 to 20 millimeters of mercury. We can lose and bring blood pressure down about 1 millimeter of mercury systolic for about every 2 pounds of body weight loss. So it can really make quite a difference. Healthy eating can make a big difference. The DASH diet, that stands for Dietary Approaches to Stop Hypertension. It's probably the most evidence-based diet to bring blood pressure down, but really many diets can that are, rich in fruits and vegetables and nuts, low fat dairy, potentially lean meats, etc. Um, but also bringing sodium down. We still need some sodium in our diet, but a lot of us have it fairly high, often from ultra processed foods, for example, or eating out where we don't always know the amount of salt that we're getting. And that can be a sizable source. And physical activity can bring blood pressure down, as well as limiting alcohol consumption. And in a lot of ways, many of us know how to bring our blood pressure down. It's one thing to know it, it's another to do it. And so we're sort of at this situation right now where we, with half Americans having hypertension, we either need some new interventions to bring blood pressure down, or we need to help people adhere to interventions that work, even including blood pressure medication that can be really effective. And so the MBBP program is designed to do actually both, that we allow people to see where they're at on the different drivers of blood pressure and to support them to go down whatever path they want, whether it's weight loss or using antihypertensive medications or improving their physical activity or working with their stress reactivity. That can be another driver. Um, and and so we're both helping people do what's called medical regimen adherence, to just do the things that work, or to actually maybe create a new way in that gives some fresh ideas and also some fresh inspiration around it. So when we were developing the mindfulness-based blood pressure reduction program, uh, we wanted to influence blood pressure, which is that bottom green box. And we already know a lot about what influences blood pressure, which is that bottom blue box. And so if training is going to influence blood pressure, it's probably going to go through the paths that we know about in terms of, say, physical activity or weight loss or diet or alcohol use, stress reactivity, medication use. So how can we influence those drivers of blood pressure? And so we started to work with a theory developed by Yi-Yang Tang and Britta Holtzel and others. That's that top blue box that basically suggests that mindfulness training helps us really just self-regulate better, that it enhances our self-awareness. So for example, our self-awareness of how we feel before, during, and after eating certain kinds of foods. If we eat something highly processed, for example, that maybe has a lot of sugar content in it, maybe we get a sugar high followed by a sugar crash, or we enhance our self-awareness of how we feel before, during, and after physical activity. That just what everyone feels better after physical activity. But not all that many people do it at the levels that are recommended. And so how can we actually foster um, positive experiences like during physical activity itself, knowing that the body can move in about as many ways as there are people in the world. And so how do we find a form of physical movement that matches what we enjoy, that matches the environment that we live in, that matches the limitations of our body, and even matches our personality type. For those who are, say, more introverted, we might appreciate, say, going for a walk in nature on our own to reflect and to have quiet and nature experience. For those of us that are more extroverted, maybe we'd like to do more team sports. For those of us that are more practical oriented, we might want to do yard work or house cleaning. There's so many ways to move, and mindful awareness can help us see what are the forms of movement that best line up with who we are, to maximize enjoyment during the physical activity as well as after. So it's these kinds of ideas that the self-awareness training can come in through meditation, where we start to come to know our thoughts, emotions, and physical sensations better, including around our thoughts, emotions, and physical sensations and how they relate to the drivers of blood pressure, whether it's food or physical activity or alcohol use, for example, or stress reactivity. And that self-awareness is pretty useful, but it's only useful in so far as we can act on that self-awareness or those insights that can arise. And that's where the attention control can come in. So the meditation training can help us learn to place our mind where we choose to place it. So maybe we're doing a meditation, say on an object of meditation like the breath or a particular part of the body or sound. It doesn't really matter where we're placing our attention. It's more that can we choose to place it where we want to place it, and uh, and then when the mind wanders, noticing where it went. And that's good information about who we are and how we are, and that's the self-awareness coming in, and then inviting the mind to come back to this moment and to this breath or this part of the body, this sound, whatever the object of meditation is. And so in time, we start getting better and better at placing our mind where we choose to, so that if we get some kind of insight or self-awareness around, say, how our body feels in relationship to certain forms of food or physical activity or alcohol or medication, that we can then act on that by placing our mind where we choose to place it. So that, say, when we're actually in the grocery store, we're selecting the foods that are good for our well-being, and when we're actually choosing to eat, that we're selecting the items that are in our fridge that are supportive of us or that kind of thing. And then the third piece is around emotion regulation, that mindfulness training can become almost like an early stress detection system where we might notice the stressors arising before they have gone too far, and that we learn certain kinds of emotion regulation strategies, like attentional redeployment, or to be able to move towards the suffering in a kind, compassionate, curious way, and to see the root causes of that suffering, and then to address those root causes rather than maybe to like avoid the challenge that's there. So those three things, those three self-regulation tools are hypothesized to be some of the mechanisms by which the mindfulness training can help us in our relationship with the drivers of blood pressure. And so we've built the whole intervention around that. And I'll start to show you some of the results. So say if we think of some of these self-regulation strategies, like say self-awareness, uh, this is in a randomized controlled trial of 201 participants, where folks on the green line received the mindfulness-based blood pressure reduction program, and the folks in the dotted line were randomly assigned to the control group that received some health education and home blood pressure monitoring and access to a physician if they needed that. And so we found that the self-awareness significantly improved in the intervention group compared to control. So that element of self-regulation seemed to get better. When we think of emotion regulation, one of the measures of emotion regulation that we had was actually depression symptoms. And so we found that depression symptoms came down significantly in the intervention group compared to control. Almost everyone was not depressed actually in the sample, but everyone's somewhere on the continuum of high to low depression symptomatology. And so we were nudging it in the direction of an even healthier direction in an already fairly mentally healthy population, to actually help prevent the occurrence of depression in the future, but also just to foster thriving and well-being and happiness. So this paper actually just got accepted last week in the Journal of Health Psychology. Um, in terms of the impacts on blood pressure itself, pretty nice reductions, about a 6 millimeter drop in systolic blood pressure through 6 months. About a 5 millimeter drop in systolic blood pressure translates into about a 10% drop in cardiovascular events like heart attacks and strokes. So it's a clinically meaningful reduction in systolic blood pressure. And in terms of some of the health behaviors, we saw nice improvements in adherence to the DASH diet, particularly in folks that had poor quality DASH diets at the beginning of the study. We saw nice reductions in sedentary behavior, like the amount of time that people were spending sitting, for example. And also improvements in overall cardiovascular health. So this was a American Heart Association combined index. It's called Life's Essential 8, and we had measures of that, like smoking and blood pressure and diet and physical activity and sleep, for example, body mass index. And so if we look at all those measures combined into one index, we found significant improvements in those going through the program compared to control. And then we were able to, in another study, look at the effects of the program on blood pressure, actually up to 2 years follow-up. This was just a single arm trial, so we didn't have a control group for that one because it was just the early stages of the study. This is about 43 participants, but actually found that systolic blood pressure also came down about 6 millimeters of mercury and it held for 2 years follow-up. We saw greater reductions in folks that had the higher levels of blood pressure, like in the uncontrolled hypertension. Though when we ran these analyses in the randomized controlled trial, we found more similar reductions in both folks with the uncontrolled hypertension as well as those with like the pre-hypertension or kind of stage 1, stage 2 hypertension. So showed some improvements across the spectrum with the randomized controlled trial. So overall, the findings are suggesting that MBBP might reduce systolic blood pressure at clinically relevant levels, that there's a number of mechanisms by which it might be operating, such as through self-awareness and emotion regulation and dietary change, sedentary behavior, and knowing that these effects were found on average for participants going through the program. We can't guarantee these results for every individual, but when we look at folks as a whole going through the program, this is the results that we're seeing so far. So just in terms of like some example practices in the mindfulness-based blood pressure reduction program, some of the things that we do that are pretty unique. One is that at the beginning of the program, we actually have a mindfulness practice where folks self-reflect on their levels of the major drivers of blood pressure, whether it's their, body weight or their levels of physical activity or their stress levels, the kind of foods that they're eating, whether they're taking their medications or not. And then just compare those levels to what the recommended guidelines are and allow people to see what resonates with them in terms of what they want to work on in the program. So, for example, we had one participant who in the program circumnavigated the state of Vermont on his bike. So he did not need more physical activity. But what he did need and want was to reduce some of the salt in his diet and also to reduce some of his work-related stress. And I ended up running into him like a few years after the program, like at a music venue, an outdoor music concert. And he'd shared how, he'd made some shifts in his career that had really brought his stress down and had made some shifts in his diet. And even 3 years later, his blood pressure was down and he'd actually been able to come off some of his blood pressure medication as a result of it. So folks, there's like many ways to bring blood pressure down, and we use an approach. It's called the trans-theoretical model for behavior change, where it's sort of the idea of, not everybody wants to work on everything that could bring blood pressure down, but what do they want to work on, and what would maybe actually make the biggest impact, and then just support them to go down that path. We provide various different mindfulness practices that are really applied to, say, diet or physical activity. So like, say, with the diet domain, we'll have people come to class with some kind of like challenging food that's not overwhelming, but challenging. Maybe it's like some kind of sweet food for folks that have a sweet tooth. Maybe it's some kind of savory food like, chips or something. If they prefer savory food, maybe it's actually a healthy food that maybe they have a bit of aversion to. And then we spend some time with that food item where we're just looking at it, like say with the eyes or smelling it or taste, feeling it between the fingers, just having a mindful eating approach where we're just actually being with all the sensations around the food. And then we slowly eat it and notice the flavors, notice how we feel and the thoughts, emotions, physical sensations before we eat the food, as well as when we eat the food. And then we also look at our experiences after as well. So say immediately after, maybe some people are getting the sugar high, for example, and then 15, 30 minutes after, maybe they're getting a sugar crash. And then we just see what insights arise around our relationship with different kinds of food. We also do mindfulness exercises, say around like physical activity, where everyone comes to class ready to do some kind of physical movement, even when we're offering the courses online. Often it might be walking or jogging or could be biking. And so we do a little bit of a meditation, noticing how we feel, thoughts, emotions, physical sensations, knowing we're about to do the physical activity, just seeing if there's generally positive feelings there, negative feelings. Not everyone's all excited about that, neutral. And then we go and we do the physical activity itself, inviting us to monitor those thoughts, emotions, physical sensations during the physical activity, as well as when we come back afterwards. And we usually have people raise their hand, if they're feeling better after the physical activity than they were before. And usually just about everybody, like 90% of people raise their hand. And so isn't it interesting that we feel better after physical activity, often for hours afterwards? And so we just start to create conditions for insights to arise around our relationship with the things that influence blood pressure. And then we use those skills of attention control training that we're doing through the different meditation practices that are grounded in mindfulness-based stress reduction to then be able to act on some of those insights. And we have particular approaches. I'll actually show you one today around how we help people act on them. So that's a bit of an overview of some of the active elements within MBBP to give you a sense of the program itself. Um, and then what I thought I might do is provide just a practice opportunity for folks who would like that. So, um, so if you'd like, I know a lot of us, well, at least on the East Coast, are at lunch break right now, but wherever you're from, where you're joining us from right now, it's a chance to, learn about the science, but also the practice of mindfulness too. So give you an invitation now, if you like, to try on this particular mindfulness practice. But again, it's just an invitation. If it's not a good fit for you, you can totally let it go and ignore my guidance with the meditations. But if it is something you'd like to try on, you're welcome to do that. And I'll guide it in a way, assuming you may not have had experience with a meditation before. And so what I'd invite you to do is to find a position that supports your comfort so that we're trying to minimize, say, any kind of discomfort or chronic pain or whatever that might be getting in the way of placing our mind where we choose to place it. So we maximize comfort, but also alertness. So if we're too comfortable, we might become kind of drowsy, for example. And so for me, in a chair, I'm often coming off the chair, the back of the chair a little bit, and engaging my core muscles that promote some alertness and help remind me that I'm doing something different than what I often do. But then say if I had lower back pain or something, I might actually use the back of the chair to support the comfort side. So again, just finding a position that's best for your body in this moment. Um, and uh, and then there's often a question of like, well, what do we do with the eyes? And so the invitation would be to have the eyes closed most of the way if you're comfortable with that, to help cut out the visual distraction. But not everyone is comfortable with the eyes closed. And if that's the case for you, then I'd invite you to maybe look at something relatively blank, like say a fairly blank wall, for example, or to look at nature is actually okay too. And so just settling into a position that fosters both comfort and alertness. And then inviting you to find some sort of anchor point or object of meditation that's with you every moment of the day. So for those who are comfortable in being with the breath, like the in-breath and the out-breath, the invitation would be to use that as the object of meditation. So perhaps noticing where the breath is felt, where it's first coming into the body and last leaving the body. So maybe at the tip of the nose or the mouth. Just simply being there with that in breath and then the pause and the out breath. Not all of us are comfortable with the breath as an object of meditation. If that's the case for you, you're in the company of many others. And so, if that's the case, you might like to try a different object of meditation that's still with you every moment of the day. So, it could be a part of the body, like the palms of the hands or the soles of the feet, or we're just there with the raw sensations, say, of touch or lack of touch or temperature, moisture, dryness, for example, and allowing that to be the object of meditation if you prefer. Then for some of us, we're not all that comfortable with a part of the body being the object of meditation. And so if that's the case for you, that's fine too. You might like to try the sensation of sound. as your object of meditation, but just the raw element of sound, such as the pitch or the volume or how regular or irregular that sound is. So, inviting you to find your way to an object of meditation of the breath or a part of the body or sound. Taking a moment to notice where the mind is, noticing if it's drifted off away from that object of meditation, and if it has, you're probably in the company of most people here. Just noticing where it went, that's good information. See if it went to the future or went to the past, noticing if it usually goes to the future, or usually goes to the past. Also inviting awareness back to that object of meditation if it has wandered off back to this breath or this part of the body or this sound. Knowing that we're all having the day that we're having, but in this moment, we're taking the time for stopping and resting. At this moment, we've got nowhere to go, nothing to do. Just here with this breath or this part of the body or this sound. Feel like we could shift gears a little bit to just take a moment to consider our relationship with the things that influence our blood pressure or our cardiometabolic health, like, say, our diet or physical activity or weight loss or alcohol consumption, stress reactivity, medication use. Just noticing if there's anything that we want to shift in our own life around our relationship with those, any shifts that we want to make, say, in our diet or physical activity or whatever it is. The shifts that we'd invite ourselves to make are almost those that are allowing us to just become who we naturally are, who we naturally want to be. In many ways, it's almost like allowing our true selves to just come out. So just noticing if anything in those domains resonate with you that you might like to make a shift on in the coming week or two. No pressure, but just if it's something that feels natural. So this meditation starts to come towards a close. You're invited to allow the eyes to open. To stretch a little bit if you like to stretch. just going to share my screen again. So as you're keeping in mind, the invitation to set some kind of goal that you might appreciate manifesting the coming week or two. And again, no pressure to do this, just if it feels natural and you want to do it. But this is something that we do in several of the MBBP classes where we invite people to set a goal for the week ahead. That this is like another evidence-based approach grounded in what's called motivational interviewing and action plan setting. So that we might consider, is there a particular intention, say, related to diet or alcohol consumption or weight loss or physical activity or stress reactivity or medication use that you'd like to set, and offering a SMART goal. So S stands for something specific that you can actually measure, uh, and the M is the measurable piece, that it's attainable, that it's realistic. Sometimes we can set these really high goals, and if you tend to do that, I'd invite you to kind of pull it back to like maybe 60% of your goal, if you like, and something that's relevant, like it will bring your blood pressure down or improve your cardiometabolic health, and also time bound. So say for me, the goal that I'm setting is to do at least 60 minutes a day of body work this week. And by body work, I mean either aerobic physical activity, strength training, or stretching. And I find I'm just better when I do those. And then the second question is, so if you like to set an intention around that, even just jotting it down somewhere if you like, you're welcome to. And then the invitation would be, just consider, how motivated are we to actually achieve this intention on a scale of 1 to 10, where 10 is high. So for me, I'm pretty motivated right now, so I'd be like a 9 or so. And then on a scale of 1 to 10, how confident are you that you'll achieve the intention? And so I'm in a pretty good space right now, so I'd also be around a 9. But I would say if you gave it like an 8 or below, maybe ask yourself that fourth question of like, what could you do that could bring your motivation or confidence a little higher? And so maybe it means changing the goal a little bit or seeing there might be a little shift there. And then also what might make it difficult to achieve the intention this week, and if that happens, what will you do? Uh, so for example, my wife is traveling for a few days this week and I have a couple kids, so I can see how it'll be harder to maybe get that in. But also my wife's traveling mostly on the weekend and my kids are both pretty active, so I'm planning like a surf session with one of my kids one day, for example. And that'll be great for both of us. So this kind of helps us get a sense of like realistically what we might want to do and also think of what might get in the way. And this has been shown to be able to help us take action on what we want to do. And it's an example of what's in the MBBP program. So I'll maybe pause here at this point, and we're going to be shifting. I know Fran has a few things to share, and then we'll be shifting to just questions and answers. And here's some information about some of the MBBP program and other evidence-based programs at Brown, as well as my LinkedIn profile if you ever want to see more stuff coming from me. But why don't we pause the presentation side and the kind of interaction side from the intervention perspective now. Shift it over to you, Fran, and then we can go to questions and answers.
Yeah, thanks, Eric. And what do you think about sharing that brief poll with folks related to the intention setting? Um,
Yeah, sure. Yeah,
so
yeah.
just a brief question. I'm going to launch that now. And again, this could be related to blood pressure risk factors, but it can also be broader if you don't struggle with elevated blood pressure. Where did during that exercise that Eric walked us through with intention setting, where did you land? What would you potentially want to focus on? And we'll just give folks a chance to fill it out. And I'll close the poll in about 10 seconds.
Completely anonymous, so we won't know what
Thanks,
everybody
Eric. Yeah.
put in. It actually gives us a sense to see who's here and what folks are interested in acting on.
Great, we're almost up to 70%. Thanks for everyone who's filled it out. And I'm going to close the poll in 5, 4, 3, 2, 1. And here is where you landed. So a lot of, about a third of you indicated that you really want to work on your stress reactivity. And then it was the second place was improving physical activity and weight loss. And then diet, nutrition, about 11% of you, and a few with something else. So I'm going to stop sharing that. Yeah, great. And so now as we shift to the next portion of the webinar, I'm going to just kind of give you some of the basic outlines and information about the blood pressure program that Eric spoke about today. But then after that, we'll definitely open it up for an opportunity to ask Eric questions. And so if you haven't already and you have questions, please feel free to put them into the Q&A portion at the bottom of your Zoom screen. Okay. So if you visit our website, you see that we do offer a number of short 8-week evidence-based mindfulness programs, which are all designed to begin the cultivation of mindfulness skills and competencies. So whether you're new to mindfulness or you are a seasoned meditator, and so all of these programs could be of benefit to you. And I'm going to focus mostly on the blood pressure program today. But one thing I do like to just highlight is that, you know, all of our courses, our programs that we offer here at Brown University are grounded in evidence-based practices. One of the strengths of our programming is our partnership with the Mindfulness Center at Brown University's School of Public Health, of which Eric is the director. And it's really that partnership that allows us one, to maintain and to uphold our commitment to evidence-based practices, but also to stay on top of cutting-edge mindfulness research that's conducted over there, of which Eric has showcased today. And so although we'll focus on the mindfulness-based blood pressure program today, I do like just to point out the other programs that we're currently offering. So there is the standard 8-week mindfulness-based stress reduction, or MBSR program. That is kind of considered the gold standard mindfulness-based program. It was developed back in 1979 by John Kabat-Zinn at UMass Medical Center and is now taught all over the world. And then we also offer 3 adaptations of MBSR. So one is mindfulness-based cognitive therapy, or MBCT. So that is a 8-week evidence-based program designed to help individuals break free from patterns that contribute to repeated and prolonged episodes of depression, as well as anxiety and other difficult mood states. And then we have a program called Finding Peace in a Frantic World, which is an accessible adaptation of MBCT. This is really a program that's designed for beginners and those with busy lives who are seeking some introduction to mindfulness practices to be able to develop and cultivate those tools to navigate life's challenges with more ease and clarity. And then there is the mindfulness-based blood pressure reduction program. So as Eric mentioned, this is really a program that's an ideal fit for really anyone living with elevated or uncontrolled blood pressure, or those who are just simply seeking to improve their heart health through a more mindful approach. And we also see many mindfulness teachers join this course and researchers who are looking really to explore an adaptation of MBSR that's tailored toward physical health outcomes. So here is the details on the course itself. And so similar to MBSR and MBCT, MBBP is an 8-week program. So there's an orientation session followed by 8 weekly sessions where you come to class for 2.5 hours per week. There's also an all-day program, all-day session that takes place around week 5 of the program. And that is usually held on a Saturday, sometimes a Sunday, from 8:30 to 4 p.m. And that all of this is held online in a virtual classroom with live instruction. And so our fall program with the orientation is going to be September 11th, with the program then running from September 25th to November 20th. It's going to be held on Thursdays, 4 to 6:30 Eastern Standard Time. And then Eric himself is actually going to be the lead instructor on our winter class, and that one starts up in the new year. Orientation is on January 7th, with the course running from January 21st to March 11th, and that one's going to be Wednesday evenings, 6 to 8:30 p.m. Eastern Standard Time. And for those who are interested in deepening their practice, we do offer 2 teacher training pathways, one for MBSR and one for MBCT, although that's not going to be the focus of today's session. So I'm going to move through these. And I'll drop this link into the chat, but we do throughout the course of the year offer a number of events related to mindfulness, both free master classes such as this, as well as more basic information sessions. Right. So we also have a speaker series running right now, and you'll find this on the event page as well. But we have our own Dr. Judson Brewer, who's going to be speaking at the end of September, speaking on ancient wisdom, modern tools, how mindfulness meets apps, AI, and neurofeedback. And all right, and I also do want to mention we are offering a discount right now. You can get 15% off the mindfulness blood pressure program that is good through the end of this month. If you enter MindHeart15, you'll be able to receive the discount. Okay, I'm gonna get out of the way, turn it back to you, Eric. Yeah, and we'll just open it up now for questions.
Sure. Yeah, I'm looking at the question and answer panel right now, and I know some are in the chat box too, but I'll just go through some of those. So I saw someone asked, in terms of blood pressure numbers, do you track what's considered normal by race? As a Black woman, African Americans tend to run higher and considered normal. And so it's there's been quite a bit of work like around body mass index and racial differences there. So they have different cut points now for body mass index by race. Say African American can have a higher body mass index and still be considered healthy, while it might be different, say, for South Asians, for example, too. And we provide some of those cut points in the program. Around blood pressure, I'm actually not aware of race-based differences in terms of their predictive ability for cardiovascular events. Uh, but of course, African Americans do tend to have higher rates than some of the other racial ethnic groups. I've been working with La Princess Brewer quite a bit at the Mayo Clinic. She's a cardiologist there. She's African American, but also works a lot with African American women. And she's doing a lot around like digital teaching stories, so that we're bringing in the culture and approaches that are unique to different cultural groups to be able to provide the trainings in ways that just resonate with folks and what they're working with, and to have the more pure teaching opportunities. So there was another question around antihypertensive medication use. Once started, can it be interrupted if the blood pressure comes down? And that's always something that you can talk about with your physician. And so for us in the mindfulness-based blood pressure reduction program, we're kind of agnostic about whether you want to bring blood pressure, your medication down, or actually maybe even bring it up. It might be skillful to bring it up. I can say that, we did have more people come down on their meds than go up on their meds, and always with encouragement to be talking with their doctor about it. And so certainly if your blood pressure is coming down and the meds are less required, then you can change your medication use either by coming down on the dose or removing the medication. We had a number of people with success around that, but always encourage you to work with your clinician with those kinds of decisions. There was a question around, do meditation apps work, and will AI be helpful in maintaining discipline? And I think meditation apps for blood pressure haven't been tested much. There's been some work with meditation apps with like blood pressure under stressful situations, but in terms of day-to-day blood pressure, not too much yet. I am actually doing a bit of work in that space personally, because I think it has some potential there for both teaching live as well as asynchronous. And I think artificial intelligence has potential there, especially if you get the large language models uh, built in a way that you've got kind of control over the what's going into those models and that they're consistent with a particular strategy and that they're large enough to provide meaningful feedback with all the caveats that can come with uh, errors being made with them right now. But I think it's really something to be looking at moving forward. There's a question around, there's no mention of regular quality sleep for maintaining blood pressure. And what's your view on sleep's role in blood pressure and using mindfulness for better sleep to support healthy blood pressure? So mindfulness training is shown to be pretty effective for sleep quality, actually. In terms of the impacts of sleep on blood pressure itself, the evidence is a bit mixed, honestly, on that. It certainly seems to be predictive of cardiovascular disease. Uh, and so, and it's one of, 8 major components for cardiovascular health that the American Heart Association emphasizes. But in terms of its effects specifically on blood pressure, the latest literature research I did on it, which was actually just in the last 6 months or so, I wasn't compelled enough by the findings to like really see recommendations there. So it's always good to do for lots of reasons to improve our sleep, whether it's cognitive reasons or cardiovascular health reasons. But specifically for blood pressure, doesn't definitely wouldn't hurt. But there may be uh, other areas to focus on that might have a bigger impact. Um, let's see. Seeing, Fran, did you see other hypo
Yeah,
the
there
chat
was a
box?
question from April asking about any reduction in diastolic pressure that you saw with the study.
Yeah, yeah, we looked at that as well. Very small reductions, not statistically significant in diastolic blood pressure. The greatest reductions were in systolic blood pressure. And after the age of 50, systolic blood pressure is the major driver of cardiovascular events. And the average age for this population was around 65 or so. Saw the significant impacts on systolic blood pressure, but not significant for diastolic and smaller there.
Yeah, and then there's a couple questions asking about whether or not health insurance would cover it. I wonder if you want to give an update on.
Yeah, sure. Yeah, we're doing quite a bit of work with physicians around this and actually health insurers, policymakers to advise. And if physicians offer MBBP as a group medical visit, that has the potential to be covered by health insurance. And so it's one of the things that we're exploring at the School of Professional Studies is a teacher training program to be able to teach clinicians and others to be able to offer this, including through medical settings, so that it can be reimbursed by health insurance. And you can always check with your particular health insurance plan to see if they might provide, like for some programs, they offer um, the ability to do programs that foster like health promotion and disease prevention that MBBP would be part of. But as of yet, it's not covered as a standalone program, say through the School of Professional Studies through health insurance. But I think there's ways to be partnering with clinicians to train them up to offer it in ways that it could be reimbursed as a group medical visit.
Mhm. Probably have time for one more. And
See one.
I'm actually wondering if in the few minutes that we have left, if you could, the long-term results are really quite impressive for behavioral intervention. And I'm wondering if you could kind of tease out for us a little bit more about what specifically it is about practicing formal and informal mindfulness that might be contributing to some of those longer term results versus, I mean, the intervention itself is only 8 weeks, so this is presumably holding beyond just the active intervention. And um, a lot of us know what it takes to be healthy, but there's something about trying to white knuckle it and just making a change that doesn't always work so well.
Yeah, yeah. a good question. I think so we did qualitative interviews with folks who went through our program to ask them how they think it operated. And big thing that came up was the self-awareness side, that they just became more aware of, say, when they were feeling stressed, or they became more aware of how, one person, like when they were on vacation, they noticed how they didn't eat as well and they drank more coffee, and that influenced their relationship with other people, and as well as their mood and just how they felt. And so in one of our papers, like in the Journal of the American Medical Association, like the JAMA Network Open paper, we actually did analyses to look at mechanisms and found that the self-awareness accounted for about 30% of the effect of MBBP on the dietary outcomes, like the DASH diet adherence. So self-awareness seems to be important. But one of the things that the qualitative work showed in participants is the self-awareness kind of came first, and then they could do something about it. And they usually did something either, say, by attentional redeployment, which meant they put their mind in a place. They use the attention control strategy to be able to place their mind where it would be more healthy for it to be placed. Or they would be using some kind of emotion regulation strategy, such as just taking a moment to stop and to take a breath and just observe the situation, and then to proceed based on what their wisdom was sharing.
Mhm.
And we found that the amount of practice that people did at home during the course predicted their blood pressure 2 years later.
Mm.
And then we measured how much practice they did, at the 6 month follow-up, the 1 year follow-up, the 2 year follow-up. That actually did not predict blood pressure. We totally thought it would be, because it's sort of like keep practicing is going to impact it. But the most important thing was actually how much they practiced when they were in the program itself, suggesting that there was some kind of crystallized insights that were happening then that stood the test of time. I kind of think of it like learning how to ride a bike. Like once we know how to ride a bike, we know how to ride a bike. We can
Mm.
get better at riding a bike and faster at it if we practice more. But there was something about the course that those that really took it on, it predicted blood pressure even 2 years after they were done.
Mm.
Yeah.
Yeah, so interesting. I know we're over time. Oh, wish we could talk longer. But thank you everyone for joining us today. Thank you, Eric, for making space and sharing these findings. And yeah, feel free to reach out directly to us if you have additional questions about the program. I'm happy to connect. But otherwise, we hope to see you in one of the classes in the fall or the winter. All right, take care, everyone. Bye.
Thank you.